Hi, this is Jimmy from QxMD, and this is a pre-recorded demo of Read and the institutional editions of Read. First, I'll take you through a demonstration of the app through the eyes of an end user before taking you through the value propositions of Read and how it will provide extra value to your institution. Moving forward, here is the iPad version of the app, if we open it up there. Now, this is web-based software, which is available through any web-based software. So this can be available on iPad, iPhone, Android, Windows, and of course, if there are any users within your institution that have not quite grasped mobile technology, this app can also be used through a desktop computer. Now, Read was designed for both healthcare students and physicians. For hospitals and similar healthcare institutions, the focus for the app is on quality and helping to drive practice change. For libraries and their students, Read helps prepare future generations of healthcare professionals with the fastest way to accessing medical information, which we do so by using the latest technology and algorithms. One thing that students and clinicians, healthcare professionals, scientists, they all have one thing in common, which is that they are very overwhelmed. There is a deluge of information out there surrounding healthcare. With medical information, it's very tough to keep up to date with around 15,000 articles being published every week. So what we've created is a way for people to access the app quickly, not have to hunt for information, but instead we use algorithmic solutions to recommend content specific and relevant to our users' practice and interests. So when you sign up to Read, you'll let us know what your profession and specialty is in medicine. Immediately from this information, the app can start to learn about which content to send you. The more you use the app, the algorithms will learn about the user's behavior and refine that content that you see. So once you find a paper that you're interested in, you simply click on that and that will start to download as you can read the abstract. Once that download is complete, you can then access the full text paper. We have listened to many of our users who want to have something on offer that no other similar apps can, which is annotation of PDFs. So you can now highlight, you can underline, you can draw specific areas and annotate the PDF in any way you want. And we can then share that via Facebook, Twitter, or you can email that to a colleague. You can also open it in different apps as well. You can comment on an article, you can like, you can dislike, and you can add this to a personal collection. Moving forward, not everybody wants to use our algorithmic recommendations. We are the only app that offers this. However, we also understand that people like to browse. So we can do that through the journal section here. And you can flip through all your chosen journals. But what we've done is we've also gone one step further by offering a keywords feature, which helps you find very specific areas of expertise in healthcare. So you can create predefined search terms like the ones in here and find content that way. And to do so, we've added some tips to the search function so that you can create predefined search terms for very niche areas of medicine. Another powerful element of the app is our community. We have 1.6 million subscribers to Read now. And of those 1.6 million subscribers, we have created tens of thousands of passionate educators who have started to create their own content. So one thing that's great about the app is that you can categorize these articles and put them away in your own personal collections. And we have passionate educators here who have started to create their own personal collections, as you can see on the left. And what that's doing is inspiring more of our users to create their own personal collections, which you can do so by clicking on the star there. And as you saw on the paper before, you can add to a personal collection. Now, your collections will always stay private, but if you feel like it's a collection that matters and you want to share it with the Read community, you can do so by clicking on private and switching that over to public. That collection is now available to all Read users and is also searchable on the keywords function as well. So just to summarize, there are many ways to discover and engage with content through Read. You can use our algorithmic recommendations based on your specialties and interests. You can keep it old-fashioned by searching through the journal table of contents, or you can discover our crowdsourced and community-curated content through the collections, or feel inspired and create your own collections, as well as our keywords function as well. Next, I'm going to talk you through the value propositions of the Read app as part of the institutional editions. We already know that from the feedback we're getting that users love our product, but we also recognise that institutions can't afford to invest in another product that simply supports just end users or library patrons. So with that in mind, we spoke to a number of librarians who asked us to consider certain features in the institutional versions of Read. And this is what we've come up with so far. Number one, we have access to one tap to full text. We know that because we make it so simple for users to discover and engage with content in a single tap, institutions that use Read will see utilization of their digital holdings skyrocket. This means that the effective cost per paper read will go down significantly, whilst the return on investment on your digital resources will go up. Next, we have analytics. We are a very data-driven company, and we want you to be able to have access to the same tools. One thing we make very clear is that this is your data, and you have complete access to it. So if we move on to the analytics dashboard, this is the dashboard which you will be given a personalized version of for your institution. Not only do we give you information on your user data, so we can let you know the number of abstracts read and papers read through Read. We can let you know how many people are registered through your institution, and we can also show you how people in your institution share knowledge. But we can also show you more important data through accession data in a way that you've never had access to before. Because we know the user's profession and specialties, this means we know exactly which types of people are consuming which content. This allows us to start asking and answering some really interesting questions. For example, if you wanted to see how well you're serving the needs of the medical students in a certain time period, you can do so by creating a filter and scrolling down to find out exactly which journals are engaging mostly with the medical students. Now we understand this is a lot of work, so we've made it even easier for you with a tool called Insights. Of course, if you want to crunch your own data, you're more than welcome to do so, and you can also download this data to an Excel spreadsheet. But the Journal Insights makes things a lot easier. We use a big data concept here to help you find insights that would take you normally hours to discover. So here's an example. Number one, we have your top performers. These are the articles that are providing significant value to your institution. We can show you the number of times an journal has been read, the percentage of people clicking through, and a number of abstract views, and even the duration of time spent reading that journal. We can also show you your poor performing journals, And we can also show you candidates for acquisition. Candidates for acquisition are journals which are not yet subscribed to by your institution, but users from within your institution have shown interest in trying to access that journal, but they have hit a paywall. So whenever they hit that paywall, that data is fed back through to us, and we can collect it to show you which journals are showing the most interest. With this usage data, it puts you in a really powerful position when it comes to renegotiating contracts with vendors. When they know you have the data like this, it changes the whole dynamic of the negotiation. These are the words from our clients, not ourselves. The third and most important aspect of where we provide extra value to your institution is through our promoted research solution and driving quality improvement. As we know, quality in healthcare isn't just a buzzword, it's a call to action. And what you have probably read in the news recently is that preventable medical error is a leading cause of death in the United States. Hospitals are constantly working on quality improvements, but quite frankly, it's very challenging to drive practice change among clinicians. So what's getting people really excited about our platform is that not only is it great for users to access and find the content relevant to them, and not only is it great for librarians helping them refine their digital holdings, but it also is great for medical leadership in solving medical leadership problems like this. Here's an example. As you can see, we have a yellow box. This is a promoted research campaign. What we do here is we use the same tricks as the large social networking platforms use, and apply them to clinician education and quality improvement. If you use Facebook or Twitter, you'll know what I mean when I say that they use ads, which are injected into your news feed based on the content you're viewing. We use the exact same technology that these social platforms use, except rather than trying to sell material goods, we give you a tool that helps you sell best practices in healthcare and ways to improve quality within your institution with zero distractions. Here is the back end of the promoted research solution, where you can create your own campaigns or choose from a pre-built campaign. Going back here, using this example, we can show you how this is done. So you can go ahead and choose qualified research, which you think is going to help solve a problem and a solvable problem, and you can disseminate this research to a highly targeted audience within your institution. By doing this, you can help a hospital's bottom line, you can save a patient's life, or even just change a patient's For librarians, this is an opportunity to leverage the value of your digital holdings and become the eyeballs of the clinicians reading it in order to enhance healthcare. We feel that Read can help evolve a librarian's role by giving them a resource that puts them in the driver's seats, bringing cutting-edge technology and data insights to help medical leadership solve real problems that affect patients and budget. To summarize, we know the product is loved by our end users, but we want to provide real value to you and your organization. We do that in 3 ways. Number 1, increasing engagement of your digital holdings through one tap. This means lower cost per paper read and a higher return on investment on your existing digital resources. Number 2, analytics to allow you to make better decisions and get better pricing from vendors on your digital holdings. And number 3, our most exciting offering, which is driving quality improvement through our promoted research campaigns. Thanks for listening.